Okay, am I audible? Okay. All right, let me start with the prayer. Namami Dhanvantal Mani Devam Surasrehi Vandita Padapadmam Lokya Jararuk Bhayam Mrityunasham Data Ramesham Vivisham. Okay, so we're going to do posology today, or Bhashajya, where we're going to talk about dosage of different kinds of medicines and what the best way of administrating these different kinds of medicines are. So basically, we're going to start with what the qualities of an ideal Bhashajya would be. Bhashajya just means different medicines, right? So they can be in any form. It can be a syrup, it can be, it can be like a kashayam, it can be a tablet form, it can be a powder form, and whatever is explained in classical Ayurveda is it doesn't include things that were patented later on. So the dosages basically in Bhashajya are strictly based on the classical preparations that were formulated ages ago. So we'll then look at we'll review the general steps that are involved in Bhashajya, and then we'll look at the general guidelines of the dosages and specific times for administrating these Ayurvedic herbs and formulations, right? So what are the properties of an ideal medicine, ideal Bhashajya? Alpamatram mahavegam bahudoshaharam sukham lagupakam sukha swadham prinanam vyadinashanam avikari cha vyapatav na ati mlanakaram chayat gandha varna rasopetam vidyat matravadaushadam. So a particular medicine, a particular Bhashajya is ideal if it needs to be administered in very small quantity, which means the medicine is so strong and powerful that you don't need to give very high dosage of that medicine, but a very small quantity itself is enough to cure your ailment. If it acts rapidly, it acts quickly in your body, and it can cure most of the illnesses. It works on all the different kinds of doshas, and if it helps to balance out all the different doshas that we have, all the three doshas that we have, irrespective of what combination the increased dosha is at. For instance, if you have a condition, like say if you have a disease where you have all the three doshas that are involved, your medicine should be such that it will help cure all the three doshas and it will balance out all the three doshas and thus cure you of the illness and make sure that you feel well and whatever. The next most important thing is that the medicine should be pleasing to one's mind by having good taste, good smell. It should look appealing. It shouldn't look very odd and disgusting where just the sight of the medicine makes you feel sick and you don't feel like having it. Now this whole thing about how our medicines don't really taste good is besides the point, because I don't know if you guys have had this problem, but I've had clients who if the minute I write a kashayam or something, they literally start begging and they'll be like, please give me some tablets to have, because kashayams are just something that they can't make, they can't even think of tasting and having, because some of the kashayams kind of taste bitter and weird. So what what is meant by having good taste is not that the medicine really tastes sweet and tastes like a dessert, and that's not what it means. What it means here is that it shouldn't taste rotten, it shouldn't taste spoiled. It should be something that the person can have, right? So by good taste here, we don't mean something that's like really tasty and all that. And then finally, this it should be something that is easily digested by the body, because the medicine has to start acting fast. So the medicine should be something that is digested easily by the body, and it should start acting as soon as it is digested. Like, you can't have a medicine and wait forever for the action to start. So the medicine should start working as soon as it is digested by the body. Most of our classical preparations that do not contain metals and that do not contain minerals and rasas meaning here mercury, right? So medicines, the classical preparations with just herbs and with just plant-based products will start working as soon as it is digested by the body. But then we have these medicines in Rasa Shastra which have a little bit of mercury, a little bit of metals in it. Like, you have metals like gold, silver, copper, and all that that's added to these medicines. Those medicines will start working the minute you consume them, because they are absorbed by the body even more quickly than these herbs that have to be digested by the body. Now, it is because of this one concept, that the medicines are digested quickly, these metallic preparations, that Rasa Shastra with these rasas, with mercury, with metals, those medicines started becoming very popular in Ayurveda. Till then, people consumed only these herbal preparations. Now, it's besides the point that in the US and in certain countries, you cannot prescribe medicines with metals. You cannot consume these medicines with metals. And like I've told you all so many times, even though you can prescribe them in India, we don't. We don't do it in our clinic, because unless the metals are cleaned really well and unless they're purified and processed well, they can really harm your body, and you can end up with kidney disabilities and so on. But this is how the bhasmas and this is how all your metallic preparations became popular, because they're easier to consume. They don't really taste bad because it's in the form of a really small pill. You don't need to have big very high dosages of the medicine. Just one or two pills do the thing for you. They look pretty decent, because most of these rasa preparations are they're made into these small pills and consumed and so on, right? So these are the basic qualities that you would look for in an ideal medicine. Now, the importance of knowing this, why a particular medicine is ideal, why do you have to know it? One, yes, you need to know it because when you're giving somebody a classical preparation, you need to be able to tell them how the medicine would be, how it would taste, and all that. Secondly, with Ayurveda, with a fair amount of knowledge in terms of what a drug does, what a herb does, how you can administer it, you can make your own combinations. Like you can make a churnam mix, you can make your own kashayam mix. You can even make your own butties. Once you've got the paste, you can even roll your own butties. So in order to do that, you need to follow these these basic principles, to say that the quantity that you administer is very little, and it should digest easily. and all that. You need to keep all this in mind when you make your own combination of kalkas or churnas or kashayams or whatever, right? So Bhashajya, it's taken it came into being from the phrase Bhesham Roga Bhayam Jayati iti Bheshajam. So that which helps you overcome the fear of illness. Roga Bhayam Jayati. Jayati means is like winning over something or overcoming. Roga Bhayam, fear of illness, is called Bheshajam, is called your medicine, Bheshajya. So these are dravyas. It can be plant-based, animal-based, or mineral-based. And these dravyas are basically used to heal, to cure you of an ailment, to cure you of a disease. Now, you can either use these dravyas individually or you can use them in a combination. When you use a combination of dravyas to make a formulation, then they are called as kalpas, right? Where you have two or more dravyas that are mixed together in a particular proportion, in a particular way, and then when you make either a tablet out of it or a churnam or whatever kalkam or whatever you make, that formulation is called a kalpas. So whatever we give today, like talisadi churnam or sitopaladi churnam or the different additives that you use, all these are called kalpas. The other thing that you have is a single drug medicine where you give only one particular herb, like you give only ashwagandha or you give only, say, neem powder, a single herb. So these are the two different kinds of medicines that you can give. One where there's a combination and the other one where you're using just one herb and you're giving that as a medicine. So studying these Ayurvedic formulations, studying these Ayurvedic Bheshajas is called Bhashajya Kalpana or Bhashajya Kalpana, where where Bheshaja means medicine and Kalpana are the different kinds of formulations that are used. Right? Now, what are the general steps that are involved in Bhashajya Kalpana? First and foremost is collecting these dravyas. So you use your knowledge in Dravya Vijnaniyam, where you know what the different dravyas are. You know the rasa, the guna, you know what karma it does, you know the virya, you know the vipaka. So basically the rasa panchadi that you learn in your dravya guna, you have to know that. And you should know the name of your dravya, the name of the herb or the plant or whatever you're using. The qualities, what it does, what dosha are you targeting, and what karma does it do. So you first collect that dravya. Now for collecting the dravya, you need to, there are certain dravyas that can be collected only at particular times of the day. There are certain dravyas that you can collect at any time. So you have a collection time that you have to keep in mind based on the efficacy of the dravya. So to know all that, you need to first of all know the rasa panchadis, you need to know some specific unique qualities of the dravya and so on. Right? Now, once you've collected your dravya, then the next thing is to purify them. So if you've collected, say, a few leaves, you need to first clean them out. You need to make sure that you've washed them. Suppose they're dry materials, then you need to make sure that whatever you've washed and whatever you've cleaned out, you have to make sure you dry it in the sun. And once it dries and all that, then you go on to the next step. So the second step after you collect the dravya is to purify the dravya. The third thing is to preserve it. Now, Preserving basically here um, is storing these dravyas. So there are certain fresh herbs that you need. Like for instance, if you're making an extract, a swarasa, you need to have fresh herbs. You can't really make a swarasa with dried herbs. The powder would be more like, it would become a kashaya. It won't be like a fresh extract. So for a fresh extract, you need fresh herbs. Now suppose I'm making a tulsi swarasa. Okay, I need to go collect this tulsi, the leaves. I need to make sure that I've cleaned them out, I've removed any sort of impurity, mud. I've taken out all the leaves that cannot be used. The next thing I need to do is find the most effective way of storing it. Now, if it is a fresh leaf that I need to use, then I immediately need to make sure that I make my formulation where I extract the juice from that particular leaf. Right? So I would go on to preparation of my formulation. Now, if I'm using if I'm going to dry my material, whatever I've collected, if I'm going to dry it, then I need to keep it under the sun, make sure that all the moisture is absorbed, and when it is ready to be powdered, I can then take it, powder it, and then store it in an airtight glass jar where I have to make sure that my dravya is free from contamination, is free from insects, it's free from external air, sun, and water, and so on, right? So that would be my preservation. Now, it's always easier to store dry dravyas. Like for instance, you can use those dried dravyas for different purposes. Like for instance, if you've made triphala churnam, and you've collected all the three phalas, you've collected amlaki, you've collected vibhitaki and haritaki. You need to dry them out really well and then store them. Now for that, I can do two things. One, I can store the three phalas directly after I've dried them, where I have the entire triphala the way it is, right? So I can dry the triphala and then I can store them separately. If I'm storing the entire fruit, I can store it separately once it's dried. Like I can have amlaki in one jar, I can have vibhitaki in one, and haritaki in one. The next option that I have is I can dry them and then powder them and store them in separate containers, where I can dry and powder my amlaki, my haritaki, vibhitaki, and then I can store them in separate containers. Third option that I have is I can mix them together after I have powdered them, and then I can store them together in one jar as the formulation, which is triphala. Right? So based on what your dravya is, what your formulation is, the kind of storage would vary, right? So once I have my dravyas collected, cleaned, and I have stored them all well. Now next I can go on to my next step of preparing the formulation. Another thing that you guys should remember is, if you're actually preparing a formulation for a kashayam, you can use fresh herbs, you can use dried powders. Churnams are basically dried churnams. For lehyams, gritams, for arishtams, for different kinds of pills or vatis that are prepared, you will use a combination of dried powders, you will use fresh extracts, so it's basically like you kind of have to grind a few herbs together and make a paste of it, and then you'll have to use the extract of certain fresh herbs. Sometimes you just have to make a kashayam with the dried herbs and then add them together. Sometimes you add the powder together, right? So based on your formulation, the different kinds of dravyas that you use would vary. Like it might be a combination of dried and wet and paste and all that. So if you have a combination of things like that, your collection of dravya will also kind of vary a bit. So what you have to collect first would be, you ensure that you have all the dried products ready, dried and stored away, because those are things that you can store for a while, and the fresh products have to be used immediately. So your fresh products, the fresh herbs, would be what you collect last. Does that make sense? So you need to actually plan out your preparation, because there are certain things like there are certain oils and certain arishtams that you require a lot of different ingredients to make, right? So based on what you're making, the collection and the what you keep ready would kind of change here and there, right? So once you've made your formulation, the next thing that you need to do is again store this formulation in airtight glass containers. If you're making a lehyam or a ghrutam, the best thing to do is immediately once it's made, like if you're going to make say 100 numbers of this lehyam, if that's what you want, you immediately put it into whatever jar you're putting it to, give it to your patient, because these lehyams, they kind of will start getting a little sticky. So basically, based on what you're preparing, you will have to make sure that you have storage ready for your formulation. The next thing is understanding the dosage of these medicines, understanding how you administer these medicines, what you administer them for, and most importantly, how, where, and when you administer these medicines, right? So the dosage and the time of administration kind of go hand in hand, and both these are very, very important. So the quantity of medicine that you administer and the time you administer them is of utmost importance. So if you administer a medicine lower than the quantity that is required, then that doesn't really cure the disease. Similarly, if you administer a medicine in excessive quantities, that would have side effects, and that would affect the person adversely. So, much unlike the popular belief that Ayurvedic medicines do not have side effects, Ayurvedic medicines also have side effects, especially the ones with metals and, minerals in it. They do have side effects. So, if your dosage is one pill, you administer only one pill. You do not administer two or three, because that means there's more, metal content in the body, which will affect the person. Even herbal medicines, like for instance, if you take a freshly prepared extract, or if you if you administer say, like, something as simple as trikatu, if you give somebody an overdose of trikatu, that herbal trikatu is not going to really affect the person. It's not going to be fatal, but what it will do is, it will increase the heat so much in the body that the person who has come to you, say for armor digestion or for indigestion or something like that, would now start experiencing acidity and burning sensation and so on. So you need to make sure that even if it's a herbal preparation, that you administer it in the right quantity, right? You're doing this so that the best effect of the herb is derived by the patient, and that helps to cure the condition that you're giving it for. Now, how you understand this dosage of a medicine again would kind of be different based on the individual who you're attending to. So what we're going to do today is we're going to look at general dosages, general principles of posology, but based on the individual who you are attending to, you can make very, very minimum alteration with the dosage of medicines to suit your client. That is something that you have to keep in mind. So what would be the criteria to that you consider before you decide the dosage of a particular medicine? The first thing is the dosha. So here you have to look at the prakriti, what the prakriti of the person is, and the vikriti of the person. So if I am a vata prakriti, and if I have a condition that is, a pitta vikriti, like for instance, if I'm a vata person and I have, say, hyperacidity, I have amla pitta. So you have to consider that I am a vata person. So you can't give me something that would basically increase my prakritika vata and make that a vikriti, make that a disease, right? At the same time, you need to give me something that will immediately attend to my amla pitta, so that my hyperacidity comes under control, right? So you have to consider both the prakritic dosha as well as the vikriti dosha. And generally what happens is, when someone's prakriti is a single dosha prakriti, or if it has all the three doshas, it's easier to manage. When they come to you with dual prakritika doshas, and that is what most of us have today. Most of us have a dual prakriti, where we have, vata and pitta, or pitta and kapha, kapha and vata, and we don't have all the three. So that becomes important for you to balance out. That becomes a little bit of a challenge for you to balance out, right? The next thing that you have to keep in mind is the agni. So you need to examine and see whether the person has manda agni or tikshna agni, or if the agni is sama agni or vishama agni. Now, based on the agni of the person, again, the kind of medicine you give would, be different, and the dosage would be different. So if a person has manda agni, you can't give very high dosages of medicine, because the medicine is not going to digest because of the manda agni. So what will happen is, your medicine is just going to go sit there, and that by itself might become armor. So you first need to give something to make the agni a little better. If there's armor, the medicine that you give, you cannot give high dosages of medicine for armor, because again, that is going to, that is not going to digest at all. So you need to give lesser quantities of medicine, and then slowly increase your quantity once the the agni comes to normal. So your first line of treatment itself would be correcting the agni. And to correct the agni, if a person has manda agni, you can't just say, okay, have double the quantity of trikatu and that will make your manda agni okay. It won't. It will go in there, and it might not even completely digest, and it might form armor, and the agni is going to further be impaired. So you need to give just the right amount of medicine, even for a manda agni, for a tikshna agni, and so on. Your medicine can basically change this manda agni into tikshna agni if you don't do it correctly, and then you'll have to reverse the whole thing, and you'll have to re-administer your medicines. So the next thing is bhala. Now, the strength of the disease as well as the strength of the person, both these, come into picture. So you can't just administer a medicine. If so, what happens is, sometimes you have these patients who come to you who are extremely weak and extremely, it's more of a psychological thing for them, where they start thinking that they have too many problems. So they come to you with a list of diseases. You start talking to them, and they'll say, "Oh, my stomach is hurting, and I have this problem, and I have that problem." And then suddenly they'll say, the back has a problem. They have a lower back ache, and then they'll say, "Oh, my hip is also hurting, and the pain is radiating to my legs." And then they'll suddenly tell you that their motion's not okay at all, and that they have something. And then they'll tell you that their head hurts, and they basically give you like this a combination of symptoms, and now you're confused. You don't know where to start, because by the time they've finished, all the tridoshas have gone haywire, and then they'll tell you that the pain is so severe, and so you actually feel that they have a really serious condition. But actually speaking, the actual problem might be something that's very simple. Like, it might just be some indigestion, or it might just be something that's very simple. But here they're thinking about different kinds of diseases, and they think they have a really bad, they're really sick. So such patients, the rogi bala is very poor. And the roga bala is also, it's probably a very small condition where you need to be able to understand whether the patient is exaggerating on the symptoms, or whether they're actually telling you the truth. And you can do that when you examine the nadi. When you examine the nadi, you'll know what dosha is higher, and you'll know what exactly the symptom would be, right? Then you have these patients who come to you with actual serious conditions, but they'll just come and they'll be like, yeah, I'm okay, I really don't have a problem, and it's fine, it's just a little bit of pain. And so you basically listen to them and you're like, oh, it's probably nothing, it's just a little bit of, maybe gastritis or something. And you might kind of neglect the fact that they do actually have a serious condition that needs to be addressed. So the first step before you administer a medicine and decide the dosage is to understand the bala of the rogi and the roga, to see if the disease actually is a strong disease which needs high dosages of a medicine, and if the patient is exaggerating on the symptoms or telling you the truth. Secondly, you again need to know the strength of the patient to digest a particular medicine. So in allopathic, you have these um, you know these antibiotics that are prescribed, and these antibiotics are really strong. And there are certain people who cannot digest these antibiotics at all, and they have, like, really, their stomach is very sensitive, and they immediately have either diarrhea, or they have a stomach pain, or they end up with hyperacidity and so on. So based on the patient, based on your client, the potency of the medicine, the dosage of the medicine, and the medicine by itself would vary. Okay, so it becomes very important for you to understand the Rogi Bala and the Roga Bala. You the patient was almost sacred. I didn't kind of get that. I first read it as the patient was almost scared. The next thing that you need to keep in mind is via of the patient, where you have to consider the age of the patient. So now, if you're giving the medicine to a very small kid, the dosage has to be a minimum dosage. If you're giving it to an adult who is in the prime of their I think so, for instance, if they're like in between, anywhere between their 20s and say 40s, they digest better, and there's more strength, there's more digestion, there's more this is basically more bala in the person. So you can give them medicines accordingly. When your client is slightly older, then you need to ensure that your medicine doesn't act along with any other medicine, so based on the age, you decide the medicine that you give. Oh, that kind of happens a lot. The best part about practicing Ayurveda is the fact that you have a tool that other doctors don't have in hand, which is examining the nadi. Once you get a little more stronger with your nadi examination, you'll kind of realize with practice that your client can't really lie to you too much, because the minute you examine the nadi, you can kind of see through all the lies they tell you when you're examining the nadi. Either downplaying the symptoms or exaggerating on their symptoms. This nadi is one of the biggest strengths you have as an Ayurvedic practitioner. So the next thing is, after age, you need to see the dravya. So based on what ingredient is used in the preparation, you accordingly would give your dosage. So like I was telling you, if you're giving a person a metallic preparation, the dosage would be very, very, very minimal, and you can't give it continuously for a very long time. You need to stop the medicines after a bit. If you're giving the medicine for, if it's just herbal preparation, then you can give it for a slightly longer time, and so on. And finally, you need to see the koshta of your client. So if the koshta is very soft and very, if it's mridu, you need to give medicines that will not, that. So this is basically the whole antibiotic thing that I was telling you, right? People who have mridu koshta and you give them a really, when they have flu or something and they have the really strong antibiotic, they end up with other symptoms and with other side effects of that antibiotic. If a person has Krura Koshta and you give them a medicine that it doesn't really work, when this Koshta comes directly into play is when you're trying to give someone a purgative, or you want to do a panchakarma on a person, and you want to administer Vasti, or you want to administer Virechanam, or even Vamanam for that matter. Based on the Koshta, you need to decide what medicine to give to induce the Panchakarma, to induce the purgation, to induce the Vamana and so on. So if you give a Mridu Koshta person a really strong dose of, say, Basti Dravya, that can actually backfire, because before you complete the administration of the medicine, they'll start purging and they'll start throwing up, and they'll actually have side effects of the medicine, of the procedure that you've administered. So understanding the koshta of a person becomes most important when you're administering a panchakarma. Even when you give a general, a general medicine, say like Swarasa extract. Swarasa, which is a fresh extract of medicine, is more powerful and more stronger than a kashayam that is made with dried medicine. Or, kashayam is watered down a bit, or an arishtam, or a tablet, right? The Swarasa is like the most potent. It's like, right, it's a very strong way of administering a medicine. So now when you do that, if you give a person who has very, very mridu koshtam, if you give them a Swarasa that is strong and you give that on empty stomach, then boy, oh boy, that person's going to end up with diarrhea, with vomiting, and is going to come back to you with severe abdominal pain, and so on. Similarly, if you give a person who has Krura Koshtam, a very mild, medicine with very mild potency, and you give a very, very minimum dosage of medicine, they're going to come back to you and they'll tell you nothing happened. I've been having the medicine and there's absolutely nothing that's happened. So you need to examine the koshtam and then accordingly prescribe medicine, the ingredients and the dosage according to the koshta that the person has. Now, this is the basic dosage that different formulations have. Swarasa is the fresh extract of a medicine. That is half pala. Half pala is, approximately about 24 ml. That is what you would give. Kalka is a fine paste. So the paste will be about 12 grams. So this is the basic dosage this is a general dosage that you give. Like I told you in the beginning of the class, based on your client, you can make changes to this dosage. Kashayam, usually you give about 48 ml of Kashayam. Hima, which is a cold infusion, again 48 ml. And Fanta, which is a hot infusion, that you give about 48 to 96 ml based on the condition and the client. Now, you can make changes to these Swarasas. If you feel that, you're giving into you feel that you want to give a slightly lesser dosage, you can, based on the person, like whatever we saw in the previous slide, based on your client, based on how your client's koshta is, how your client's doshas are, and so on, you can make slight changes to these dosages. But this is the general formulation, this is the general dosage that you would give for different Ayurvedic Kalpanas, right? It's just a matter of time before you get a hang of how your client would react to something and how you can make changes to the dosage. If you have a doubt, if you examine every parameter but you still have a little doubt, especially if you have a client who is already on various medications and they've come to you because they want to slowly cut down on those medications and then start having Ayurvedic medications, you can't just cut down on all the allopathic medicines that your client has been having, right? So in that case, you can make changes. You can make, or you can alter the dosages. You don't have to give them a 24 ml swarasam and then have them have all the modern medicines that they're having. You can slowly make changes, and you can start with a lower dose of the Ayurvedic medicines and then slowly work your way up, while they can kind of balance out on the Ayurvedic and the modern medicine, and then slowly decrease the modern medicine's dosage, reduce it, and use the Ayurvedic medicine. So based on your client, you can kind of customize the dosage and all that based on the dosha, based on the body of your client, how the koshta is, how fast they digest their food, and so on, right? Now, if it's a churnam, if it's a powder formulation, then you use about 12 grams. Now, with most of these medicines, it would always work well if you gave it with an anupana, with a vehicle, right? Say, for instance, if you're giving a churnam, you can either give it with a ghee, or you can give it with honey, or you can give it with, some kind of a liquid. So, based on what the condition is, all these medicines all these formulations can be given with an anupana, right? So it becomes easier for your patient to have, and it works faster on your client also. Next thing is a lekhe, which is like a jam preparation. So ideally about 24 to 48 grams is what you need to give. Grita, ghee preparation, again 24 to 48 grams. Gutika. Gutika are basically these pills that you can roll and make into small circular pills. They are also so there are different forms. The original, the age-old Ayurvedic pill formulation was these gutikas that you roll, right? You make a paste of whatever your medicine is, and then finally you roll it into small balls. So that is gutika. Now, gutika has to be given in numbers, like you can give 1 or 2 pills. The 12 grams here basically refers to the quantity of medicine that you would require in your pill. So if my pill has 12 grams of medicine, then my dosage would be 1 pill. If I'm going to roll only 6 grams into a pill, then I'm going to have to give them 2 pills. Does that make sense? So this 12 grams that is mentioned here is the quantity of kalka that I would require to roll my gutika into, my pill into, right? After a while, what happened is these rolling pills kind of changed, and then people started making vattis, making these tablet forms where it would be slightly bigger tablets. Again, for the tablets also, this is the basic the basic dosage that you have to keep in mind. 12 grams means 1 tablet is what you would give. So the dosage basically here is based on the amount of kalka that is present in your medicine, right? The next thing is asava. Asava is a fermented herbal mix. So for that, you give about 48 grams of it. So generally 48 ml of 48 ml is what you give. So 48 ml of asava, and arishta also 48 ml. Right? That is what you would give. So these are the general formulations, the general dosages that you would give. And if you guys ever have doubts when you're prescribing a medicine and you don't know how to give it, or you have a doubt about what quantity has to be given and all that, initially when you start your practice, you can kind of have this as a cheat sheet somewhere on your table, so you can kind of use it that way, right? Now, dosage for children, this becomes a very important thing. In Ayurveda, there's a completely different set of medicines and dosages for children, and there's a branch in Ayurveda also called pediatrics. Where uh, you study in detail about how you give it, how you give the medicines for a small child, and what kind of anupana you give along with it, and so on. So for a newly born child, for an infant, the dosage should be very, very little, right? And in as the child grows older, your dosage would slowly increase. So you give about one rati, which is like 120 mg for a 1 month old child. After that, every month you increase, you can increase one rati, that's about 120 mg. You slowly keep increasing it till the child is 1 year old. Once the child is 1 year old, then you need to stop. You need to stop giving increasing the dosage, and then you need to kind of stabilize the dosage. It should be about approximately 1.4 grams, right? When you're giving them a patented drug, or like when you buy, say, like you buy a tablet from Maharshi or from somebody else, what you need to do is you just need to see what the dosage at the back. You have you have that thing with the ingredients and how many grams are used. So you need to total that out, and then you need to take a call on how many pills to give, or what your dosage should be, right? So for children between 1 to 4 years, the dosage should be between half to 1 masha, which is about 1.5 to 3 grams of medicine. And after that, you look at the bala, the agni, and all that of the person, and then you decide how to give. And for small children and for adults also, the weight also comes into picture, especially for small kids. So based on the weight, based on how they digest the food, you can decide the dosage. Right now, there's a special thing in Ayurveda called Rasayana Chikitsa, where you give a particular Rasayana as a rejuvenation therapy, right? So there are certain Rasayanas, like there's a Rasayana called Pipali Vardhamana Rasayana, in which you give, you keep increasing the dosage of the medicine. Say, for instance, if you're giving it for 7 days, or you're giving it for 14 days, based on your rasayana, the duration will change. Suppose you're giving it for 7 days, what you would do is for the first actually for the first 3 days, you would slowly increase the medicine. On the 4th day, you would give the highest dose of the medicine, right? Then again, from the 5th day onwards, you will start decreasing the medicine again, and then on the last day, you would completely decrease the thing. So what it does to your body is it slowly helps to build your dhatu, like the first day, the second day, the third day. So it slowly will help build up the dhatu. Once you have the peak dosage of the medicine, and then from the next day onwards, you slowly reduce the dose. This is called Vardhamana Rasayana. And when you the Pipali Vardhamana Rasayana, there are different kinds of Rasayanas, but the most common of them is Pipali Vardhamana Rasayana. So this is a very specific way of prescribing that particular medicine. And once you're done with that, it's kind of like a complete rejuvenation that your body, your body would have, right? So similar pattern you also see with the administration of certain gritas that are given before you do your panchakarmas, where you have to, where you slowly increase the dosage of the grita, and then you slowly decrease the dosage, right? Now, the time for administering the medicine, this becomes very important. Like certain medicines you have to give, on empty stomach or early in the morning. Like, for instance, when there's, kapha vyadhi in the throat, that you give medicines earlier in the morning, right? Or if you do this purgation therapy, there's a particular oil that you give early in the morning, and then you start cleaning basically detox your bowels and all that. But that medicine is also administered early in the morning. Before your food, you give medicines where you have an apana vata vikruti, where you want to strengthen the agni. If the agni is really weak, or for people who have hyper acidity, there are certain medicines that are given before you have your food, so that it forms a little layer in the stomach, and it doesn't really hurt your stomach when you eat your food, right? It's like a protective layer that is formed for people who have ulceritis and so on, right? So that's like, you administer the medicine before the meal. During the meal, when there's a Samanavata Vikruti, when there's Vishama Agni, then you administer the medicine during the meal. This medicine called Ashtachurnam, the most effective way of administering that medicine is, with the first bolus of your rice. And you mix it with food, and you have that first thing, because and then you have to continue having your food. So that's how that medicine works the best. Um, After your food is over, you give medicines that have a Vyana Vata pacifying effect, a Kapha pacifying effect, and medicines that can be given to help aid digestion, help when case of indigestion and so on. Food medicines that don't taste really good, and you have to give them to children, or very people who are very delicate and who can't really have medicines that are not this thing, you give them medicines that you mix with food and give. Then there are some medicines that you have to give before food as well as after food, like when you're treating convulsions or trembling or diseases of the lower body. Between two meals, you give medicines when there are disorders of Vyana Vata, and when there's outward moving air. With each morsel of food to help stimulate digestion when you have aphrodisiacs and so on. Between bites of food is when there is a disorder of the Prana Vata. Repeatedly, if you have to give somebody medicine, like they have to keep having that medicine in case of cough, in case of vomiting, hiccups, when when a person is poisoned and all, you need to keep administering the medicine as long as the medicine is required. Something like talisadi churnam or shitopaladi churnam, when someone has a cough, you ask them to keep having that medicine, because that will kind of soothe the throat, and that will give them a very soothing effect, right? And then at night, at bedtime, when when you have a disease of head, neck, ear, nose, throat, especially these medicines that you give a person when you want them to relax, when you want them to sleep, people who suffer from insomnia, all that, you give them the medicine at bedtime, and preferably followed uh, by an anupana that will help aid the whole process. So um, based on all these factors that we've talked about, you can decide what dosage of medicine you would give a person. You can decide the dosage based on the agni, the dosha, the disease, the age, the kind of koshta. You have to understand what dose to give, at what time you would administer it, and there are so don't always go with the general principle that we've talked about today. Don't always blindly prescribe something, where you see someone, so okay, this is how it works. Sometimes what happens is, based on the individual, there will be a little change with the way they digest medicine. So keep that in mind, right? For any medicine that you prescribe, you just need to ensure that you're not doing something against your client's body, against your client's way of digesting food, digesting medicine, and against the way your client's body works, right? So understanding your client, understanding the dosha, the age, the why, all that becomes the most important before you decide what dosage to prescribe, right? Any doubts you guys have? I'm done. I'll answer your questions on the chat if you guys have any doubts. So, who was doing the client encounter can do the client encounter now, right?
Thank you, Priyanka ji. All right. Awesome.